Hi, this is Dr. Clark Brittain of Vibrant Life in Bloomington, Indiana, a board-certified gynecologist, talking to you today about hormone therapy in women. Why do they resist? Why do they want it? What are the challenges? So about 1997, there was a study begun called the Women's Health Initiative. It enrolled women to either take hormones or not take them, and take different types of hormones. And then the researchers were going to decide at the end of the study, what happened and what does that mean. So 9,000 women were recruited to take Premarin, 9,000 women were recruited to take a placebo, 9,000 women were recruited to take a medication called Prem-Pro, which is a combination of Premarin and Provera. So Premarin is a conjugated estrogen, Prem-Pro is conjugated estrogen with a synthetic form of progesterone. So at the end of 5 years, they discovered that the women who were taking the Prem-Pro, the conjugated estrogen with synthetic progesterone, had a little increased risk for breast cancer. And so they decided that they needed to stop that part of the study, which was the ethical thing to do. At the same time, they discovered that the women who were taking the conjugated estrogen or Premarin by itself actually had a little bit less breast cancer, so they thought ethically they could continue with that study. The problem happened when the press got a hold of that information and misunderstood it. Because Prem-Pro has some estrogen in it, they incorrectly assumed that the estrogen was the cause of the increased risk of breast cancer. And thousands of papers published articles saying, oh my gosh, estrogen's killing women, quit taking it. So the upshot of that was that lots of doctors, thousands of doctors, quit prescribing hormones, millions of women quit taking them. That wasn't really what the study showed. The researchers went on for another 8 years studying the conjugated estrogen and the placebo patients head to head. And at the end of the 13 years of that study, they discovered that the women who took the Premarin by itself had 20% less breast cancer than the women who took nothing. So in that study, it showed that actually taking a conjugated estrogen was protective against breast cancer. But no newspapers published that. Very few physicians heard that. All the people understood was the initial publicity from this article, or from this research really, that suggested that taking estrogen was bad for you, and it takes a long time to overcome that prejudice. So I read the original article. I said, oh my gosh, here's a golden opportunity for my patients to improve their lives. And so I started using the estrogen-only therapy along with a natural progesterone if they needed it, and had plenty of conversations with my patients who would come in and say, well, my aunt got breast cancer and therefore I don't want to take any kind of hormones. And when I explain the results of the study, it starts to turn the tide. Well, there's other studies that have shown that women who take estrogen properly decrease their risk of death from heart attack. There's a understanding by the people in the medical community that study this a lot, the International Menopause Society, the North American Menopause Society, and others, American College of Obstetricians and Gynecologists, who say that women in menopause should take hormone replacement therapy unless there's some specific contraindication, and that the women who do take hormone replacement therapy properly reduce their risk of death from preventable disease by 50% compared to women who don't take anything. This should be shouted from the treetops and the rooftops, and put banners in the sky behind airplanes that take your estrogen, take your estrogen. But no, we as physicians are a little hesitant to embrace this information because we have this fear from the incorrect interpretation of the study done in 2000 or published in 2002 that estrogen's not good for you. But think about this. Women spend roughly 40 years of their lives making a lot of estrogen, and it's really good for them. Menopause comes along and they quit making estrogen. Their bodies start to deteriorate. Is estrogen no longer good for them now? Well, obviously, just because we quit making it doesn't mean that it's no longer any good. But the smart doctors from around the world, smart doctors from the International Menopause Society who say, you got to take it the right way, and when you do, you decrease all of these unwanted side effects. There are a few contraindications to taking hormone replacement therapy, but they're not very many. Women who have a known estrogen-dependent cancer, pregnancy, undiagnosed bleeding, these are patients who shouldn't be taking estrogen. In fact, the American College of Obstetricians and Gynecologists recently published a committee opinion that says even women undergoing treatment for breast cancer can safely take vaginal estrogen if they need it for vaginal dryness in menopause, even undergoing treatment for breast cancer. So the take-home message is that estrogen is good for you for 40 years. It continues to be good for you even in menopause. And think about how you want to feel. What does estrogen do? It helps prevent hot flashes, night sweats. It helps with memory, concentration, mood, vaginal lubrication. It helps keep your bones strong. These are really important things. And the proof of the matter is that it's safe and it's effective if done properly. So I don't want you to be afraid of it, but to have a dialogue with your doctor and find out what is the real story about estrogen, what are the statistics, am I better off taking it or not taking it? In fact, it's so important to take for a really long period of time in menopause that the North American Menopause Society says you don't have to stop ever, and that there is no scientific evidence to suggest that just because you get to be 65 or 70 years old, you should stop taking your hormones. There's no scientific evidence for that. So I hope that dispels a few myths about hormone replacement therapy, and I hope that gives you a little bit of encouragement to consider taking it. I'm Dr. Clark Brittain of Vibrant Life, Bloomington, Indiana. Reach out to us at www.drbrittain.com. Visit us at Vibrant Life on Facebook. Call our office 812-331-9160. Have a great day.